Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What is new with suicide prevention? Find out more right now. My first guest this evening is Ariel Gordon of EveryMind. Ariel, welcome to the House Call.
Hi there. Well, thanks for having me.
Briefly tell our viewers about EveryMind and then go on to tell us your particular role.
Yeah, absolutely. So EveryMind is a nonprofit organization based in Rockville. We've been around for over 60 years providing mental health support to the local community in a variety of ways. We have a number of programs supporting students in the schools, supporting individuals who are veterans or military affiliated. We provide support to unhoused or homeless folks in the county and in the surrounding region. And we also provide education and training for the local community around mental health, signs to look for when someone might be struggling with mental health, and really working to equip everyday folks to know how to respond and have some tools in their toolbox for really helping out their loved ones and others in their world. And in my role, I actually oversee our hotline program. So our hotline is 24/7. We respond to a number of lines that come into our team. We answer the Montgomery County hotline, which is a local supportive listening line. We are also the Montgomery County responder for the 988 crisis and suicide lifeline. We answer those lines by phone, but also by chat and text. So we are here again 24/7, 365, interacting with people at every age, every background, who are either reaching out because they are in crisis, or because they're having a bad day, because they're feeling isolated and need someone to talk to in a confidential and anonymous setting.
Briefly tell our viewers about the suicide crisis nationally.
Yeah, well, we've certainly seen over the past 5 or so years the increase in mental health crisis in every age group and really every demographic. Suicide is a part of that spectrum, and we saw the 988 suicide and crisis lifeline launch and as part of a response to really wanting to make sure that folks who are experiencing thoughts of suicide, folks who are experiencing, who are using self-harm as a coping skill in response to mental health struggles, that they have someone at all times to contact and to kind of talk through and be aware of their resources and options, but also really to have somebody to listen, and to listen with non-judgment and kind of a blank slate. We are often talking with folks who might have a long-term mental health provider, or who do have strong support systems in their families or in their communities, but it can be helpful to have a different perspective, or just somebody who doesn't know, your whole background, or might not have their own perspective on your situation, and to have that as a very open-ended resource.
What are the numbers, the unfortunate numbers nationally, let's say going back to the last decade, and then compare and contrast that with what happened during the COVID-19 pandemic?
Yeah. So again, we really saw the numbers go up in the past 5 or so years, and that's true nationally. That's also true locally. Although Maryland, we can feel good that Maryland is kind of the third least, the third lowest in terms of suicide rate across the country. So we have again seen that increase, but really seen the trend as well in increased options for folks to know that it's okay to reach out, and also really in the efforts to reduce the stigma around that outreach.
What effect does a difficult economy have on suicide rates? For example, until recently, we had national runaway inflation. Fortunately, now it's much better. But did you notice a uptick in suicide attempts at that time?
So I can speak for our local services, and I can say, some of the ways that we see the economy impacting suicide, thoughts of suicide, or an increase in thoughts of suicide, is also again in that isolation. Folks who maybe had a community in their workplace, or they had the stability that was provided from a steady employment. That then, if that's pulled out from under you, the responsibilities of supporting family, again, the responsibilities of continued support for yourself, but also in terms of access to support. So one of the reasons that the hotline is so important is because it's free, because it's available at all times. So we know that it is challenging to get access to mental health services, and economy and the cost of accessing those services is one of the big barriers. And so that's one of the ways that there are definitely negative impacts of a struggling economy in terms of increasing the risk of suicide, and the different ways that folks' daily lives can become more overwhelming and feel more hopeless. But we've also seen that highlight the need for creating more ways for folks to get that help with lower barriers and lower cost.
Who funds 988 and these other programs, such as your EveryMind?
Yeah. EveryMind's funding comes from a variety of sources. 988 itself is also a variety of sources, though it's largely, we do receive funding from Montgomery County government. We receive funding from the state of Maryland. We also receive funding from the federal government, from SAMHSA, Substance Abuse and Mental Health System Administration. So there are a variety of funders for this work, and we've really seen more of again, kind of a shining of a light and a recognition that the system needs to provide that funding so that folks can access it at low cost or no cost.
One thing that was really striking about the COVID-19 pandemic was not only the obvious concern about COVID-19 exposure and people getting very sick and even dying, but emotionally, you had hundreds of millions of people globally who were isolated in their homes, cut off. What did you see as some of the consequences of that being cut off from society?
Yeah. So one of the ways that we kind of track this and that we see it impacting our interactions on the hotline is that there are folks who are reaching out to us regularly. We have some folks who reach out daily. We have some folks who reach out weekly, but it really, in some cases, especially for the more elderly population or folks who might be homebound, which was always the case during lockdown of COVID-19, we're the only kind of touch point, the only social interaction or verbal interaction with someone else on a daily basis. And so it definitely we can see it create a sense, again, of hopelessness. There are fewer options. There are fewer coping strategies that folks can lean on, fewer people that folks can reach on a regular basis as a result of that isolation. And that creates a real need for a service like a hotline who can partially fill that gap. Of course, we're not a long-term relationship, and that's a different kind of support. But we also saw, folks young people going to schools and having teachers to interact with and counselors and other supports outside of their parents if their home life was challenging. Those supports were stripped away during COVID-19. And so that the isolation has an emotional impact. It also has a physical impact of kind of keeping folks away from some of the support systems that are in place and we can all be interacting in person.
One thing that you said that is informative but also troubling was your comment at the top of the show that the suicide risk appears to be across all demographic groups, all age groups. So let's start out with some of these categories. Veterans, what are you seeing with veterans in terms of post-traumatic stress syndrome and suicide risk?
Yeah. So with veterans or folks who are affiliated with the military, because there are some folks who are either active duty or family members and spouses, we see there's, of course, the potential for post-traumatic stress syndrome. Also, there's an increased access to a lethal means for suicide. So in the culture and community of the military world, there's more access to guns, to lethal means for following through on thoughts of suicide. And so that's something we're always in tune to when we're talking with someone who discloses that they are either a veteran or affiliated with the military. We also know that accessing, again, some of those supports and services that are help to support folks in the reentry process and regain that stability can be challenging to access right now. There are limited resources. So one of the things that we do on the hotline is we're able to connect people with actually another program of EveryMind, which is called Serving Together, who essentially provides case management and care navigation support for veterans, folks who are military affiliated, to know what those resources are, to really from the full spectrum of additional services that someone might need. They have someone to help them get connected and get that, to follow through on that, to get that service. So that's one way that we can help connect people with follow-up, but there are definitely factors that specifically impact the military community that we have to be aware of when we're interacting with visitors on the hotline.
We've got a little over a minute before we go to our break. Let's go on to discuss two other different groups. One is young individuals, kids, teenagers, what have you, and their unique challenges, and compare that with adults. And you got 1 minute to reply.
Okay. Well, the biggest thing that I would say is that young people, we really see reaching out on chat and text, particularly text. So that's great because it means that we've created an opportunity for people to reach out when they're not comfortable using a phone. There's a higher layer of anonymity on chat and text. But what it also means is that it can be really challenging as a counselor and for our team to really build trust with someone, especially a young person who might be communicating in one-word answers or even using emojis. So we as a team are really trying to listen, to ask those open-ended questions and make sure that someone knows, especially a young person reaching out in a way that they might be cautious about, or they might be unsure if they can trust it. We are really here to listen and to create that space to meet them where they're at. And it's definitely it's a good sign that people are using that service, and it means that, you know, we can reach more people by having that option available.
Excellent. We're going to pause briefly for a public service announcement. More about suicide prevention in a moment. We'll be right back.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You all right?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You
can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
We're back. Our topic tonight is the national suicide epidemic and suicide prevention. My next guest is Dr. Lisa Horowitz, a psychologist and member of the staff at NIH. Lisa, welcome to the Housecall.
Thank you for having me, and thank you for highlighting this really important public health problem of suicide.
My pleasure. So briefly tell our viewers about your background and your role at NIH.
Sure, I'm a clinical psychologist, but I specialize in working with pediatric psychology, and I'm a researcher in the intramural program, and I study suicide prevention in the medical setting. So I work on how to give doctors and nurses tools so that they can identify people at risk for suicide and then be the bridge to getting them help.
Fascinating.
And yeah, the reason, so just to keep going with you asked about youth. So suicide is the second reason why kids die. And, there's a good portion of young people who are dying from something that is potentially preventable. So when we look, we see that most people, and this is adults and young people who die by suicide, have visited a healthcare provider sometimes weeks before they die. And so it's a really good opportunity to identify people who are at risk in the medical setting and then get them help.
So speaking of tools, share with us the screening tool you've developed to predict suicide risk.
Sure, it's called the ASQ. It has 4 questions on it, and then if somebody says yes to one of those, screens positive, then you ask a 5th acuity question. And do you want to know what the questions are?
Please.
Okay, so the first one is, in the past few weeks, have you wished you were dead? The second one is, in the past few weeks, have you felt that you or your family would be better off if you were dead? The third question is, in the past week, have you been having thoughts about killing yourself? And the last question is, have you ever tried to kill yourself? And it's meant to be very blunt, very direct. So if someone says yes to that, then the doctor or the nurse is supposed to ask, are you having thoughts of killing yourself right now? So it takes about 20 seconds, and it's meant to start a very awkward conversation, right? It's a way to give doctors and nurses a tool so that they can have this very important but very hard to start conversation about someone thinking about killing themselves.
Do you ever ask the individual if they say yes to these questions? Have they developed a plan how they would do it?
Yes, so those are some of the follow-up questions. So there's a big difference between, sorry about that, a big difference between screening and assessment, right? So this is meant to be a screening tool. And because it takes only 20 seconds, it's meant to pick up people who need further assessment. And then during the assessment, you ask them the risk factors, like someone who has a detailed plan about how they would kill themselves is at much more risk than someone who doesn't. And, a lot of times the biggest myth about suicide is that if you talk about it, you're going to put the idea into someone's head. And there's at least 4 research studies that show this is not true. And in fact, the opposite is true. The best way to keep someone from killing themselves is to ask them directly, are you thinking about killing yourself? And then really brace for that answer that might not be no, right? The answer that might be yes, or maybe, or sometimes. And it's important when you hear that answer, you don't panic, that you don't feel like you have to fix it in that moment, but that you listen and then try to get the person help. And, your earlier guest, Ms. Gordon, had recommended all these ways that someone can get help, like suicide lifelines. And I know your next guest is going to talk about that as well.
If somebody has a family history of suicide, is that a red flag for you?
So there's different risk factors that put someone at greater risk, and having a family history of suicide is definitely one of them. There's also young people between the ages of 15 and 24, or people over the age of 60, people who are identified as LGBTQ plus are at greater risk. And there's a bunch of risk factors, people who have a mental illness, anyone who's had a previous suicide attempt, or people who have a medical illness. That's an often overlooked risk factor. So all those are risk factors, but what's even more important than risk factors are warning signs, right? Because if you were in the emergency department and you were a triage nurse and someone came up to your desk and they had risk factors of a heart attack, like they were a smoker or obese, had hypertension, and they walked up to your desk, you wouldn't think they're having a heart attack. But if they came up with the warning signs for a heart attack, like they were clutching their chest in pain and they were sweating profusely, you would think, heart attack. Same thing for suicide. There's warning signs that are even more important. And one of the biggest warning signs seems obvious, talking about suicide. Now, that one, believe it or not, is often overlooked. So a lot of times when people talk about wanting to kill themselves or wanting to die, we don't take it seriously. So it's really important to always take talk of suicide very seriously.
And on note, we're going to transition to our next guest. Thank you, Lisa.
Thank you.
Sarah, welcome to Housecall.
Thank you. Thank you for having me.
So briefly tell our viewers about your role in the Montgomery County Health Department.
Sure, absolutely. So I'm the director of the local behavioral health authority here with Montgomery County's Department of Health and Human Services.
And we've just heard a very compelling opening to the show about the national and local statistics. And we heard an excellent summary from Dr. Horowitz about the suicide risk survey, the screening tool. So now we're at the bottom line. What kind of services does Montgomery County and the state of Maryland provide to prevent suicide?
Absolutely. So as the local behavioral health authority, we work closely with the state of Maryland, with the behavioral health administration, and we really ensure that there is access to resources for people who are experiencing suicidal ideation and experiencing other behavioral health concerns. So one of the biggest resources that's available that we really like for all of your viewers to know about and to use is 988, what Ariel Gordon was talking about earlier today. It's a great resource, and the folks on the other end of the line are able to connect callers to services as needed. In addition to 988, we also have the Department of Health and Human Services Crisis Center. This is a walk-in center that is available 24 hours a day, 7 days a week, 365 days per year, and fully staffed with licensed clinicians. And the Crisis Center is located in Rockville in 1301 Picard Drive. You can also call the Crisis Center for an over-the-phone assessment. We have mobile crisis teams that can come out onto location to provide in-person assessments when needed. So the phone number for the Crisis Center is 240-777-4000. We also have a website called betheone.org. This website was developed initially to help young people in Montgomery County hear more about the kind of the what to do when they have concerns about a friend experiencing either suicidal thoughts, or if they're using substances in dangerous ways. BeTheOne.org provides information about how to support their friends, and it goes through 5 steps, including ask, keep them safe, be there, help them connect, and follow up. And on that website, we also have a link to resources, which includes other links and websites that are really helpful for people to get more information and to get more help. We have a resource list that the local behavioral health authority maintains. And it's a list of all sorts of different treatment providers in Montgomery County. We also, last but not least, we have, due to the concerns of suicide in Montgomery County, a group of us came together to create the Montgomery County Suicide Prevention Coalition. And we have about 35 plus stakeholders who attend these monthly meetings. They are open to the public, and we talk about resources, updates from experts, data, trends, and we identify various initiatives and activities that we can do together to make an impact on the community to raise awareness of suicide prevention.
Very impressive. It's been said over the years that suicide risk increases during happy holidays, Christmas, Thanksgiving, New Year's Eve. Is it your coalition's impression that that's true?
There are a lot of times increases as people are kind of taken when they're experiencing times that should be happy, or quote unquote, they're that can increase risk factors. Suicide is rarely due to a single event or a situation. It is multifaceted and complex human behavior, and there's a lot of layers that are involved.
Well, I want to thank you for all three for joining us this evening for a very informative, practical review of suicide prevention. I want to thank the team at the studio, and I want to thank you, the viewer, for joining us this evening. Tell us how we're doing. You can reach me on the email listed below at the screen. As for our next topic, it's going to be an important one, weight reduction. And I'll have Dr. Joseph Green, who specializes in bariatric surgery, and he'll be reviewing not only surgical options, but also some of the new injectable drugs that are quite effective for weight loss. See you then next time for another edition of Housecall. Good evening.